well-being of the people and the well-being of the country depends on the population.
Family planning is an excellent idea. I think it can help people in very many various ways. But I feel like in Uganda we are not adequately informed.
Family planning kitegeeza kubaana n'abaana babiri oba ne wenzaala 10 naye nga bali mu family planning.
I still hold the view, just like many of my people, that having contraceptives amounts to early abortion. I'm that conservative.
Family planning is not family killing as people think. It is spacing, giving a mother and a child chances to get what they should have.
Family planning I've used for so long now. Let me say since 2002. And my family planning, it has no any problem at all. For me, I use injector plan.
Family planning is about having the number of children you want, when you're ready, and at intervals you want. Very few women in Uganda can make these choices, and often it can be a matter of life and death. Families that practice family planning benefit from a mother whose reproductive cycle is planned. Serious family planning campaigns in Uganda started around 1957, spearheaded by civil society organizations with little or no government support. But over the years, government has taken a keen interest.
Government, when we took on primary health care around 1980, government integrated family planning in the maternal and child health services and started to build capacity for service delivery.
In Uganda today, a woman will give birth to between 6 to 7 children on average, a big burden for a country where there is widespread poverty and most households survive on less than $1 a day. There are many challenges hampering access and utilization of family planning services, including misconceptions about family planning, culture, poverty, stockouts of contraceptives, and lack of adequate service providers.
The culture, it believes in having many children. And culturally, it's a man who makes a decision in the home. The man may want to have many children. Me, as a woman, I have no decision to make because I'm dependent. The woman is dependent on what? On the man. And they also have a belief that they have their own method of family planning where they have to use herbs and some other methods, which usually are not effective.
No kwetaiminga nze kenyini. Whenever I'm about to reach, I come out. And I pour somewhere else.
Most people still do not understand what family planning is. While others view campaigners of family planning with a lot of suspicion.
You come from Kampala, only 10 miles to each side. When you go beyond the Kawanda, you will see a vast land grown in the grasses and whatever. No function is taking place down there. Which land so are you out crying? That is very small. What kind of people are you there? Are those the towns you want to create in Africa? And most of in Kampala? When we are 30 miles apart? No, that is childish. They are playing on our heads.
Another big challenge is lack of male involvement. Most men look at family planning as a woman's issue.
Men don't like family planning methods. They even don't come as couples. And they discourage them because they say when women join family planning, they will become infertile. Out of like 100 men, you can see one.
Men want many children and polygamy. You can find one man having 5 wives, 4. And each woman is delivering every year.
The 16 mothers who die daily in Uganda due to pregnancy and childbirth-related complications are largely poor and underprivileged women, majority of whom are in rural areas. They face enormous challenges accessing family planning services. With almost half of the women who need family planning unable to access these services and about 300,000 abortions performed every year, increasing family planning services for everyone is paramount.
The conversations to me have tended to be elitist and white collar. The last person in the village cannot gain access to contraceptives and all those related issues.
Promotion of family planning services is important if Uganda is to reduce the high maternal and infant mortality rates and thereby achieve her National Development Agenda and the Millennium Development Goals. Despite the challenges, government and other partners continue to play a big role in providing family planning services to those who need them, and commendable achievements have been registered.
I think there is better acceptance of family planning, and we are seeing that the supplies, the system, although not 100% perfect, the system of getting supplies to the people who need them is getting better and better, and involving both government, public sector and the private sector.
Akelo Grace is a resident of Kasubi Quarters, Gulu town. Like most Ugandan women, she's a housewife with no steady income, but she's been able to plan for her family because of family planning.
Family planning I've used for so long now. Let me say since 2002. When I got my firstborn, I stayed again after some 3 years and a half. Then I got a second-born. After second-born, I stayed again for some 3 to 4 years. Then again I got the third one. Now the third one is 5 years, and the second one is 8 years. Firstborn is 11 years. And my family planning, it has no any problem at all. For me, I use injector plan.
Akela is lucky because she has a supportive husband. They have spaced their children and already know the number they want.
It was helping me because my children were not falling sick. They were not disturbing me. Even feeding them was very easy. So there was no any problem there. And up to now, my children, they are not sick.
Jackson Musamami and his wife is a unique couple in their village. Most men in this area are polygamous with many children, but for him, he has only 5 and the last one is in secondary school. With family planning, they've been able to plan well for their family.
Tuli batono, tuli babiri twenka ni baby waife tumuleseyire mukulu tatupapya kyetwenda kyetukola wetuendera wetufumbira tuwine tuwalya twaja mu nnimiro ezira mwana ali tusumbuwa kyova obana nti family planning enungi ife abaana baife bakulayira
bamboneraku ndi ekyokuboneraku ye bali kuba nze nsobola n'okubasesa nti bana olw'okuba ndina famire entono edde naliire kumamba aye ng'ewuwe tagiriire kale ekyo kyona kyenkarejinga bali okukoba ati ndowooza twandigiire twaba mu family planning.
Vicky Adongo from Gulu district is married with 2 children. She has 5 other co-wives, all depending on the husband's little income. But with family planning, she's been able to space her children and look after them.
Yeah.
48-year-old Henry is married with 6 children. Before he heard of family planning, he faced several challenges.
kube wange twali nga tuzaala ne mukyala wange abaana nga kwaga kumpi twenda kuzaala buli mwaka n'okuyira eneka n'agayira ku twati n'atyama nimu nange namweta namugayira ku enkola eyo namukoba nti ayi kisayine tube nibwo tukozesa ku kunkola dinada family planning abaana bano tuli kuzaala bakulala ino.
The challenge of the big unmet needs threatens to undermine the gains so far made in family planning. Zakia Babire from Namugalwa village in Iganga district has 6 children already, an average for most women in her area. She is still young, and failure to access family planning services, she's most likely to conceive and produce more children, straining the meager resources of the family. To improve access to family planning services, the government of Uganda has come up with 11 commitments.
Members of Parliament are also representatives, and in our constituencies where we come from, we are always interacting with the people. So it will also be important for members of Parliament to fully appreciate these commitments so that they can also communicate these same commitments to the people they represent.
The current budget for reproductive health is 8 billion shillings, equivalent to just over $3 million. This budget is grossly inadequate compared to the family planning needs of the country. Uganda needs over 600 billion shillings for the next 5 years if the country is to have all the reproductive health supplies it needs. There have been concerted efforts from key players to promote access and use of family planning services in Uganda. One such player is the School of Public Health at the Makerere University College of Health Sciences. The school has opened the Family Health Research and Development Center to build the capacity of the university academic staff in reproductive health research and also provide family and reproductive health services to the communities working with partners.
So this center comes in place after identifying and knowing that there are health indicators which are not very good, and try to see how can we involve the policymakers, how can we involve the implementers, how can we involve the programs, even the students whom we teach, how can we be practical, how can Makerere provide a community service out there to make a change, to cause a change in the indicators of health that are of importance to the nation.
These efforts need to be informed by evidence and well coordinated for the desired success.
If we look at lack of family planning as an enemy towards maternal health of women, then we had better come together and bring all those resources that we have, bring the technical people, bring the people with the platform, the religious leaders, the politicians and everybody, so that we fight against this thing that has caused the death of our women.
Let the policymakers put in money for the health workers to go deep in the villages. If we could go for outreaches, we could do better.
When you are attending school, it does not give you that time of thinking to get married at that early stage. That means prolongs your marriage. You will marry at a later stage, which will again reduces the number of children you will give. So I think the government should put much emphasis in education.
Politicians should support family planning. They should advocate for it. And the technical persons should be there to guide and also build the capacity of these other technical persons on the ground in family planning. When we have done that, then we should educate the community. We should continue providing or increasing the awareness on the benefits of family planning.
So I need to have a policy well documented and at the same time be assisted to be implemented.
If we have an agenda and players are all putting in their energy, financing the strategy, and it is led nationally, Ministry of Health leads it with players involved, we shall definitely achieve. We've seen that happen with HIV, the HIV campaign. We've seen that happen in some areas in health, immunization as well. So family planning can also come on board strongly from top leadership, including the political leadership.